Hi, Chris. Shall I start?
Hi, Dr. Chew. Okay. Hi, everybody. I hope you can hear me. If not, please message in the group chat that you cannot hear us. I've mute most everybody. If you need to ask any questions later, there'll be a Q&A. You can type your questions in the group chat. I will relay to Dr. Chew. So let us begin. Tonight's speaker is Dr. Chew Li-Ping, the consultant hematologist and medical advisor for SCAN. She'll be talking about COVID-19 and what cancer patients should know or do in this situation. So let us all give a virtual hand to Dr. Chew Li-Ping. Dr. Chew?
Hello, everybody. Welcome to our first webinar series on the COVID-19 pandemic and cancer patients, organized by the Society for Cancer Advocacy and Awareness, Kuching. I am Dr. Chew Li-Ping, the consultant hematologist working in Sarawak General Hospital, Kuching. One of my duties is to treat patients with blood cancer and also do screening of patients for COVID-19 infection during these difficult times. So what is COVID-19? It causes a disease called coronavirus disease, or in short, COVID-19. It is severe acute respiratory syndrome coronavirus 2, or better known as a short form SARS-CoV-2. CoV-1 actually caused the first SARS infection. So this is the CoV-2, which caused COVID-19. How is it different from the normal flu? Well, normal flu causes a death rate of about 0.1%. However, COVID-19 can cause death up to 5 to 10%, which is almost 50 to 100% more than, 50 to 100 times more than your normal flu. So it is a very dangerous flu-like disease, and usually patients die due to lungs or heart failure. What would you do if you think you have COVID-19? In Sarawak, if you think you have COVID, from Monday to Sunday, from 8 to 5 p.m. for swabbing. In Kuching and Sarawak at this moment, there is no other private hospital who is doing the swabbing. When is the right time to do a swabbing? If you have these symptoms or contact with probable COVID-19 patients, you present with high-grade fever, cough, severe lethargy, difficulty in breathing, diarrhea, or severe headache. When you have severe headache, it might mean that you may have low oxygenation. So do come to the hospital quickly. So what is swabbing actually for COVID-19? Swabbing is where but with a longer stick will be inserted into your nose and also your mouth to obtain a sample of mucus from the sinus cavity to take a sample from your throat. Neither the swab should hurt, but they might be uncomfortable enough to trigger a cough or gag reflex. This morning I had a swab done. It is not the most comfortable feeling, but it doesn't kill you. It just makes you sneeze. And the mucus sample will be sent off to a lab, either in SGH or the Unimas lab. You will only be called if the result is positive. So no news means good news. So does the history of cancer raises your risk for health complications for COVID-19? From the recent studies from China, it appears that patients with cancer and survivors of cancer may be at higher risk of health complications from the patients with a history of cancer have a higher incidence of severe complications, which includes needing intensive care, unit care, mechanical ventilation or breathing on a breathing machine, or death compared to patients who do not have cancer. Chris, can you hear me? Sorry.
Yes, I can hear you.
Okay. Why are these cancer patients prone to complication? Well, this is not surprising given that this group of patients are often immune compromised. So this immune compromise is a state where the individuals are robust to fight an infection than that of an average healthy adult, and are at a higher risk of getting infections, including viral infection, which is COVID-19. So there are many reasons that a patient might be immune compromised. Example, having health conditions such as cancer, diabetes mellitus, heart disease, older age, or lifestyle choices such as smoking, which can all contribute to a weakened immune system. So the immune status, what makes the immune status in a cancer patient weaker? So patients with cancer may have a weakened immune status because of older age, type of cancer that they have, whether it's a stage 1 or a stage 4 cancer, the type of treatment or chemotherapy they are receiving, whether it's very intensive or mild type, and other health conditions which the patient has, such as diabetes mellitus and lung disease. So the risk of time of active cancer treatment, which usually means the beginning of the cancer where it is first diagnosed, and also during treatment with chemotherapy. There is no specific test to determine if the person is immune compromised, although doctors usually find numbers such as low white blood cell count or low levels of antibody in the body likely indicate an immune compromised state. So, question, if I am about to start cancer treatment, should I consider postponing treatment due to COVID-19? So to postpone or not depends on the aim of the treatment. Is it for cure or is it to palliate? Because we want to avoid a potential infection with COVID-19 because we do not know who are the contacts of COVID-19 patients are. The treating oncologist about the risk of postponing treatment versus the potential benefit of decreasing your infection risk. So things to discuss with your doctor include the goals of cancer treatment, whether the likelihood that the cancer will be controlled with the treatment being planned, the intensity of the chemotherapy, and the side effect of the cancer treatment, whether your body will be severely weakened or just mildly, and what are the supportive care available that is to reduce the side effects of the treatment. So you can ask things like, will my blood count be very low? Will I catch and be mistaken to have a COVID-19 infection instead of just a normal pneumonia? And during chemotherapy, if my bloods are very low, would I be able to get enough blood support, blood transfusion, since no blood donors are coming to donate blood? So these are the things that you can ask your doctors. Infection during chemotherapy. So a recent study from China with cancer who had COVID-19 showed that patients who underwent chemotherapy or surgery in the past month had a higher risk compared to those who had not received any recent treatment. So the risk appears to be higher in patients with more than one chronic medical condition, such as concurrent lung disease or diabetes mellitus. Patients who are undergoing active treatment for cancer are presumably at higher risk than those who are in remission, meaning those who are just diagnosed or have relapsed disease, compared with those who is unstable. Those beyond 1 year of treatment are more protected against COVID-19 infection, so they are safe. So if I'm getting chemotherapy, which is very intense, should I interrupted? So clinical decisions should be individualized. Every patient is different, and we should consider factors such as the risk of cancer recurrence, if the therapy is delayed, modified, or interrupted, the number of cycles of therapy already completed, and the patient's tolerance for treatment. For example, those patients who are in deep remission who are receiving maintenance therapy, stopping chemotherapy may be an option because you are just receiving maintenance. So interruption of treatment might not be dangerous. Or some patients may be able to switch from chemotherapy for intravenous IV to oral therapies so that this will decrease the frequency of clinic visits. When you modify treatment, the decision on modifying or withholding chemotherapy should include consideration of the indication of the chemotherapy, where the patient is in the treatment course and their tolerance for treatment. So for example, the risk-benefit assessment for proceeding with chemotherapy in patients with untreated extensive small cell lung cancer, which is very dangerous, and if you don't treat, the patient will die, is different from that of a patient who is on stable disease for many years and just on maintenance chemo for a metastatic non-lung cancer tumor. So you have to talk to your doctor, actually, what are the risks and benefits of your treatment. As local transmission at this moment affects Sarawak General Hospital because Kuching is one of the hotspots in Malaysia, reasonable options may include giving chemotherapy break for 2 weeks or 4 weeks, or you arrange infusion at an unaffected satellite hospital, such as other district hospitals like Lundu, Bau. They will try to cater to you. And then patients receiving ongoing surveillance, such as imaging scans for detection of recurrence, active surveillance for existing disease, can they be delayed? So in general, as recommended by CDC, any clinic visits that can be postponed without risk to the patient should be postponed. These include the routine surveillance in patients considered to be at relatively low risk of recurrence and those who are asymptomatic during follow-up period. So in situations where the existing recommendation provide frequency, you still need to scan 3 to 6 months, it is reasonable to delay the scheduled interventions to a longest recommended frequency, maybe longer at 6 months or 10 months, so to reduce your contact with hospital. So what is the advice for people with cancer? Therapy, having radical radiotherapy for lung cancer, have cancers of the blood or bone marrow such as leukemia, lymphoma, or myeloma, who are at any stage of treatment because these diseases are quite debilitating and immune suppressive. Having immunotherapy or other continuing antibody treatment for cancer, having other targeted cancer treatment which can affect the immune system, such as your protein kinase inhibitors. Those who had a bone marrow or stem cell transplant in the last 6 months or who are still taking immunosuppressive drugs. Another way you can help yourself is shielding. You can continue to have visits from anyone who helps you with essential support. For example, food providers or carers. However, all visitors should wash their hands with soap and water for at least 20 seconds when they arrive at your home and often during the visit to care for you. Shield meaning fever, cough, sore throat. Okay, they should stay at home. Avoid family gatherings, even in private spaces, and ask family or friends to arrange shopping for you and leave it at your door. So what about if you're living with other people? What should you do? So anyone who lives with you should reduce their contact outside their home where possible, meaning your family members should not go out so much, but they do not have to practice the same shielding measures as yourself. However, they should practice social distancing. Social distancing means spend as little time as possible with other people that you live in shared spaces such as kitchen or living room. And keep these areas well ventilated, meaning open all windows, let the wind come in. Try to keep 2 meters or 3 steps away from people you live with. Sleep in a different bed where possible. Use bathroom if possible. If you need to share a toilet and bathroom, this should be clean after you use them. Everyone should wash their hands regularly and avoid touching their face, and clean frequently touched surfaces such as doorknob and tabletops. So the question, will I be safe in hospital if Sarawak General Hospital is treating COVID-19 patients? Well, Sarawak General Hospital has strict infection control practices because SGH cares for patients with complex health condition. It's the only tertiary hospital in Sarawak, so we cannot close shop. But we have expertise in treating patients with infection and infection control and prevention. Our infection prevention practices and protocols are aimed at protecting our faculty, employees, and contractors, as well as patients like yourself and visitors. Any patients with respiratory symptoms as a way to contain their respiratory secretion and to prevent spread of infection to others. They will be immediately guided to Medical 5, which is newly open, to get a COVID-19 swab. Each patient on the appointment day is asked if they have to fill in a form asking if they have any symptoms such as new cough, shortness of breath, muscle aches, or fever. We also inquire about potential exposure to patients who may have tested positive for COVID-19 and whether there has been any recent travel history within the last 14 days. This is for the patients to answer honestly. So when you're in the hospital, should I wear a face mask to prevent COVID-19? I strongly advise you to wear a face mask if you do come to hospital. I mean, wearing a face mask is not an ironclad guarantee that you won't get sick, because viruses also can transmit through your eyes. So the quality of the mask is also very important. However, the masks are effective in capturing the droplet, which is the main transfusion for the coronavirus. And some studies have estimated that it has a roughly 5-fold protection versus no barrier protection at all. However, masks will make little difference if you're walking around in town, taking a bus, so there's no need to bulk buy a huge supply of masks. But in hospital, you never know who has COVID-19, so it's best to protect yourself by wearing a mask and do not touch all the surfaces if not needed. So what does the CDC recommend? Initially, CDC does not encourage people to wear masks, although Malaysia does. Only recently, over the last few days, that they recommend wearing a mask. So recommendation is to wear a mask everywhere in this world. So we know from recent studies that a significant portion of individuals with coronavirus actually lack symptoms or asymptomatic. That means there are no symptoms at all. And that even those who eventually develop symptoms can transmit the virus to others before showing symptoms. This means that the virus can be spread between people interacting in close proximity, for example, speaking, coughing, sneezing, or eating together, even in those who are not exhibiting symptoms. In light of this new evidence, CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. Example, your grocery shopping and your pharmacies, where there is area of community-based transmission. I see a lot of video YouTube teaching people how to wear a mask, but I feel removing a mask. First, clean your hands with soap and water or hand sanitizer before touching the mask. Avoid touching the front of the mask because that is where the droplets are captured. So therefore, the front of the mask is usually contaminated. Only touch the ear loops, ties, or the band. So for face mask with ear loop, hold both of the ear loops and gently lift and remove the mask. For face mask with ties, untie the bottom bow first, then untie the top bow and pull the mask away from you as the ties are loosened, holding the ties. What about face mask with bands? Lift the bottom strap over your head first, then pull the top strap over your head. Then throw the mask in the trash can and remember to again clean your hands with soap and water or hand sanitizer. So what about hand sanitizer? CDC recommends washing hands the amount of all types of germs and chemicals on hand. If soap and water are not available, then you can use a hand sanitizer with a concentration of at least 60% ethanol or 70% isopropyl alcohol, which inactivates the COVID-19 virus. Any percentage less than this will not kill the virus. Therefore, making your own hand sanitizer may not be the best choice. You can either use too much, which can burn your hands, or use too little, which does not kill the COVID-19 virus. What about, can I use household cleaners on my hands? So always follow the instruction on the household cleaners. Do not use disinfectant sprays or wipes on your skin because they may cause skin and eye irritation. The disinfectant sprays and wipes are not intended for use on human or animals. They are intended for use on hard, spray Clorox on your hands. It will kill you. And finally, if you do not want to come to hospital to get your prescription, what can you do? Well, in Kuching, you can log into this apps at JK and sarawak.moh.gov.my/service, and you will go into a Google Sheet. Put in your name, and your name will be registered to the state office, and your drugs will be delivered by post laju to your house or the address that you put in. But you have to pay 5 ringgit and 30 cents for each delivery. You pay the postman when you receive the medication. However, for new prescription, patient still needs to come to the hospital to get a new script. I think with that, I thank you. Any questions?
Thank you, Dr. Chew. Anyone with questions, you can type in the group chat. Does anyone have any questions?
I just came in and left the session. How come don't have?
if you have any questions, you can unmute yourself and then ask the question.
Is it possible to have a copy of the slides for our keeping?
This presentation is being recorded, so we'll put it up on Scan's YouTube page as well.
Sorry?
We will put this up, this whole video of this
Okay.
webinar on hopefully on Scan's YouTube page.
All right. Okay, thank you. It's a very interesting, very informative talk, really.
Hi, Dr. Chew. Punui here.
Hi, can you hear me?
Yeah. I have one question about patients going for blood tests in SGH.
Yes.
It's well known the lab is at Clinic Pakar, not too far from emergency and E&A. And do you think at this point in time it's okay for cancer patients to go for blood tests at GH?
I feel if possible, because I've seen the blood taking area is very crowded. But if you're getting chemotherapy without checking your blood, it might be dangerous, because then we cannot assess whether your body can take the next dose of chemotherapy. So however, the place where you're taking blood is actually very far from the COVID area, and the COVID patients do not cross that area. They go to the lower ground, basement. So you don't worry about meeting COVID patients who are coming from ATD. The only thing is you might not know that the person who is next to you waiting for the blood test might have COVID or not. So it's best to wear your mask. So I'm not sure whether the private labs are open. If you can afford it, you can get it done in the private labs. But if not, you have no choice but to get it done in SGH before you get your next dose of yes, if you can think, you know when is the less busy time, or you can talk to your oncologist whether is the blood test really necessary.
Okay. Thank you for your answer.
So
Jody has a question.
Maybe I answer the question from the group
you
chat.
can see the group chat. Yes, please.
Yeah. So of course, from Zoo, how about cancer survivor? Of course, anybody can get corona, including the Prime Minister of UK. So nobody is safe. This virus do not care whether you're old or young, rich or poor, whatever ethnicity, they will catch you. Because it's just a normal flu. So be careful, everybody. So Fitri asked, she's seen many people wearing gloves during grocery shopping. Actually, I think it's overkill. Wearing gloves in a correct way so that you don't expose yourself, that is more difficult. So I think you don't really need to wear gloves too much. Then from Jody. So I see, so a lot of people are using the fabric mask. It depends on how good your sewing is, or how safe, how many layers it is, and do you wash your fabric mask. I think to be safe, every time you use once, you've gone out and you come back, you should change it. You shouldn't reuse it or hang it, and you may touch the front of the mask, so will expose you to contamination, which is dangerous. So if you are able to Clorox your face, your fabric mask, it will be better. Then from John Ting, can the patient recover usually in SGH, they'll do 3 swabs. So the first swab, you get an ambulance, a personal ride to the hospital. You'll be quarantined in wherever your designated area. Then they will repeat 2 swabs. So they will only release you once your swab is negative for 2 times. So you will not be a risk to other people. From Zoo, is it okay if I'm going to SGH? Because so if you need to go, you have to go, but if it's not 100% necessary, you can postpone it. Melissa, we heard about the asymptomatic. Yeah, so lately we had a lot of worries in the hospital, so we have been checking a lot of our healthcare workers, and we found that there's about 5% that they do not have symptoms. They are well working about, and they are COVID-19 positive. So these are the people who are dangerous, who can infect you because they look normal, they behave normal, they are not sick, and you think it's safe, but it's actually they are not. And how virulent these people are, these people can be quite virulent because one ICU staff has affected quite, I think about 5 people, colleagues, because they were eating together. So shouldn't eat together. Fitri, and the numbers we are seeing being reported daily, relatively low, not many. Yeah, so we think that the numbers that we are seeing are actually not the accurate. Maybe we are only capturing about 60 to 70% of patients. At this moment, the kits are sufficient because Sarawak government has been very helpful, using the own state money to purchase more. So far, we are testing as many as we can. John, can we assume that people recovered? Yes, we hope that people who have recovered have developed immunity, but how long the immunity can last is another question, because it's just a common flu, and we know that we can get flu many times a year, just as influenza, where we need to get revaccinated every year. So at this moment, I think we will develop immunity, but perhaps to the strain, the current strain. In the next few months, we don't know whether the virus has mutated or not. Okay, thank you for your questions. Do we still have time?
Yeah, we do. Any
Yeah, I
other
have
questions?
one more question. A question, I think, I'm not sure whether, I think you have not answered. I saw the question actually, because we talked about general versus so-called the common people.
Yes.
Cancer survivors versus
Yes.
common people who don't have cancer before. Yeah.
Okay.
The
What is the question?
risk level.
So the risk level is higher than the normal people. So cancer survivors are people who have cancer and the body has received chemotherapy before. Some of them may not recover fully. They may get complication due to the chemotherapy. So they are more prone to complication compared to the normal public. But the risk of getting the coronavirus is the same. It's just that they might develop more complication than the normal people, but the risk of getting the coronavirus is the same.
Dr. Chew?
Yes.
Hi. Actually, my flu jab is due in May. So you think I can just...
When do you get your last jab?
Last May.
last May. So the new influenza jab just came out in October 2019. So if you had your jab in May last year, most probably is for the old season, the previous season. Because the new season, the new strain just came about in October. So you should get your next jab at this moment. But I'm not too sure whether is it available, because when we wanted to buy in January, February, it was out of stock. So you may stock.
So I can't rely on my dosage from GH then. Because yearly I'm jabbed in GH at Dr. T's clinic every May. Yeah. So that's why I'm wondering whether, because every year, every May, when I go back to the clinic, they'll give me the flu jab. So I'm worried that they also don't have, because my GP, they have. So should I just go
maybe in June after Raya?
After Raya? But mine is due May.
May. So
actually, my appointment is 5th May.
5th May in GH.
GH.
I'm not sure whether they still have stock. May need to ask.
Because I was a former pneumonia patient. So I think that's why they usually do give it. I mean, I get it from them yearly lah.
Maybe when you see them, maybe just ask them whether they have it. If they have it, they should give it to you lah. But if they don't have it, they need to buy and wait until the stock comes about.
I see. Okay.
Okay.
Thank you.
The next question is, among the infected COVID patients, how many percentage? So actually, children, we are not really doing active surveillance, because so far the children, there's only one child who died in US, but that child was 5 years old and she had a lot of medical problem. So in GH, we only had I think 2 or 3 cases where the recovered very well, because children always recover very well from flu. They don't get much problem. Then from the pool of recovered COVID-19 reported prognosis. So yes, so because we just started this disease, so the prognosis after recovery and quality of life, it needs time. So we can only answer you after 6 months. But people, because China had the pandemic earlier, so cases have been reported from China that those who recovered actually lost a lot of weight. The quality of life is not back to normal, because the lungs, especially those who underwent ventilation on the machine, they did not really recover very well because the lungs are damaged. But if you are just a normal flu without much problem, then you will not have much side effects. But those who have breathing under the machine, they'll take. All cancer patients and survivors should get flu jabs. But in SGH, the stock is limited. So most of the jabs can be received from the GP. I think the last time I bought from my staff is only 35 ringgit one jab. So it's not very expensive. But
my GP charge 100.
Yeah, so they charge you for the needle, the syringe, the cotton wool, and poking you, talking to you. But actually the cost is only 35 ringgit to 40, depending on whether anybody is fighting worldwide to get the jab.
Right. Thank you.
Is there any other final question? If there is no final question, click hand to.
Yeah. Thank you so much. Thank you, Dr. Chew.
Okay, thank you very
Dr.
much
Chew.
to everybody for participation. Okay, good night.
Thank you, Dr. Chew.
Thank you everybody for attending.
Thank you, Dr.
There will
Chew.
be a
Thank you,
part
Chris.
2 this
Thank you,
Saturday.
Bunloy.
Thank you very much.
Okay.
Chris. See you, Chris.
See you.
Thank you everybody for listening. Good night.
Thank you, Doctor.
Good night, Dr. Chew.
Thank you. Good night.
Thank you, everyone. Thank
Yep.
you.
Yeah, Chris, you the man.
Thanks, Dean. Okay, good night
Thank you
everybody.
very much, Chris, for organizing. Thank you.